my name is Elise Smith, and this is my Immersion Head to Toe assessment. So before I even come in the room, I will have I've gathered my supplies, checked my patient order, closed the door for privacy, come in, wash my hands. I'm identifying the patient by two identifiers, name and date of birth on their wristband, explaining why I'm here, getting consent, and then upon just initial assessment, I can see that the patient is well nourished, well developed, and then I would add, and well groomed. I'm going to ask the patient 4 questions to make sure they are alert and oriented. So do you know what year it is? Do you know where you are, why you are here? And if you were to look outside, what is the weather like? Also, who's the president, just because that's a big day in history as of yesterday. So then I would assess skin first. So skin is, just from what I can see before I kind of dive into it, so least invasive first. Skin is intact. When I feel the skin, it is smooth, warm. It's not excessively dry or oily. There's not excessive perspiration, and it is not diaphoretic. So moving to the head, I would palpate. Well, first it's normocephalic looking upon inspection. Upon palpation, it is also normocephalic. There are no masses, nodules, lesions. Inside the hair, I can see that there are no vermin or scales, and it's evenly distributed. Not excessively dry or oily as well. Moving to the eyes, I can see that the eyes are symmetrical. There is no drainage or swelling or erythema around the eyes. I will pull down to see that the sclera is pink and the conjunctiva is opposite. Conjunctiva is pink, sclera is white. And then I will use my pen light and assess for perla, so to know that the pupils are equal, round, and reactive to light and other accommodation. And now, how many fingers am I holding up? Okay, if they were to say 3, we know that vision acuity is intact. And now looking at the nose, it is proportionate with the face. It is midline, there is no drainage. And looking inside of the nose, the mucous membrane is white, or pink and moist. It is not white. And I would do the smell and patency test. So I'll have him close his eyes, plug one nostril. We'll use a cotton ball with alcohol, put it under one nostril. We would plug the next nostril. We can see that nose patency is intact. I'm going to move this way to the ears. So upon initial assessment, ears are proportionate. They are midline, there is no drainage. I will pull up because they are an adult and look inside. I can see that the bony structure is at 7 o'clock 5 o'clock on the right ear, 7 o'clock on the left ear, and the tympanic membrane is pearly white. And then I would do the whisper test, so ABC, and then do that bilaterally, so on the other side as well. Now moving to the mouth, I can see, could have kept this out the whole time, but the mouth is, the tongue is midline and proportionate. The mucous membrane is pink and moist. There are no dental caries, loose or missing teeth. Indentation is intact. And have them say ah as well for the rise and fall of the soft palate. Moving to the neck. The trachea is midline, and it is easily displaced. The thyroid is non-palpable. And then I would check the carotid pulses one at a time, so I don't strangle them. While I'm checking pulses, I'm gonna go ahead and do brachial, radial, popliteal, and dorsalis pedis. Make sure that those are all 2+ bounding pulses. Now I am going to go to heart sounds. So I will let the patient know that I'm going to listen to the heart. I'm going to pull their gown down, but let it be as private as possible. And upon initial assessment, there are no masses or lesions or scarring on the chest. There's nothing to note. Now I'm going to listen to the heart sounds. So we will listen at, let's see, the aorta, aorta, pulmonic, Erb's point, tricuspid, and mitral valve. And we want to note S1 and S2 sounds, and make sure there are no arrhythmias or murmurs. Then going on to lungs, we will listen to lung sounds. Just keep these on also. So 5 places on the front. And then I will assist the patient in sitting up and do 9 places on the back. So 1, 2, 3, 4, 5, 6, 7, 8. And then you want to you get all the way down here. 9. Okay. And I'm also, while I'm here, going to assess drains, any wounds, any IVs, any tubes present. You want to assess them all for any signs of infection, so redness, swelling, drainage, if they're tender, if they're hot, so a rise in temperature. And you just that would go with the skin assessment as well, but we just want to make sure all of those are intact and flowing or suctioning, whatever they are meant to be doing is what we want them to do. So we do that, and now I am going to move on. Well, we're gonna do peripheral vascular, so we will do capillary refill, and we want that to come back in less than 2 seconds. And skin turgor is good, so we tint it and we want it to come back to normal in less than 2 seconds as well. Cap refill could be about 3 seconds also. And there's an even distribution of hair throughout the body. Also, there's not any excessive patches of hair. And now for the abdominal assessment, so I am gonna lift her gown, but we would keep the sheet as high up as possible, so as to provide privacy. We also, I forgot to mention in the very beginning, we would lift the bed, the head of the bed, but this is already lifted, so I'm not gonna put it down, but for the abdominal test, we want them in the supine position with, knees bent. This seems excessive, but there we go. And so upon initial assessment, just inspecting, there are no hernias, ecchymosis, lesions, peristalsis, venous pattern, striae, or scarring on the abdomen. We want to auscultate first, So I'm going to listen to the bowel sounds starting in the lower right quadrant. So we will start down here, working our way up, and you want to listen for vowel sounds. Normal limits are are 10 to 30. Anything less is going to be hypoactive, and anything more is hyperactive. And we will then palpate the abdomen. And if you hear anything abnormal, you're going to want to listen for a full 1 minute in each quadrant. Also, backing up, I should have started from the beginning with vital signs. So for this adult, we would do an oral temperature. So normal limit or normal range is 98.6 to 99. I would do a blood pressure with the automatic blood pressure cuff provided. We want it to be about 120 over 80. Heart rate is 60 to 100. Pulse is going to be 50 to 95. Respiratory rate, we will watch and count. We want that between 10 and 20. I would note the patient's height and weight and make sure the BMI is hopefully within normal range, which is 18.5 to 24.9. And then we want to check pulse ox, which he would be attached to. We want that above 97%. That looks good. And then we will do range of motion. So I would have the patient, if they could get up and walk, we would have them walk across the room, make sure their gait is steady and even. We would also do our exercises, so we would flex and extend. We would do this bilaterally. Have them push down on my hand and then push back. The hips and other things that we need to do standing, we would do if appropriate, but we would have them adduct and abduct their leg, their arm, push up with their shoulders on my hands. I would push down. We can do wrists as well. And then just kind of ask if they have any questions. I would lower the bed back down, wash my hands before leaving. Make sure the call light is in reach, let them know that when I will be back and kind of what the next steps are when I know. And then I would leave and provide privacy after I left again.